Hi, my name is Gaston, and we're going to go ahead and discuss some key concepts from week 1 for the week 2 discussion. We'll go over disease, classification, etiology, pathogenesis, signs and symptoms, syndrome, diagnosis, complications, prognosis, and diagnostic media. What is disease? Disease is an acute or chronic illness that an individual acquires or is born with, and it causes physiologic dysfunction in one or more organ systems. So it affects homeostasis and affects the way our body should function. It could affect one organ system or it could affect multiple. We see here that there's different classifications. So I already mentioned that there's acute, there's relatively severe but self-limiting. It can be a period of 6 months or less. You have a severe reaction, but with proper treatment and proper modifications, this can generally be taken care of and fully recovered under 6 weeks. It won't be something that an individual experiences over a long period of time. That would be your chronic disease right here, which is continuous, long-term process, either runs its course or has exacerbations. What I mean by runs its course is it's something that someone can maintain over a long period of time and live a normal lifestyle, but then can be exacerbated by something like stress. An example of that could be somebody with lupus who is living a normal lifestyle, but then is exacerbated by life stressors and then breaks out with the common lupus rash or has issues with the kidney or other body systems that are associated with lupus. Then there's subacute, which is intermediate and is median, or it's between acute or chronic. It won't be as short term as an acute disease, but it won't be as long term as chronic, where the individual is going to have to make lifestyle changes they'll have to monitor for the rest of their life or possibly take medications for the rest of their life. Another thing to take note of for disease is the International Classification of Diseases, which is ICD coding. Hospitals use this, clinics use it. We had ICD-9, we recently moved to ICD-10, and now ICD-11 is even available. This just tracks certain trends of diseases, their causes, what populations are being affected by it more than others. We move on to etiology that discusses the causes of disease and how those are brought on by certain agents and how they affect the organ or organ systems. We have physical, etiologic or biological, chemical, hereditary, or genetics. Physical are the things like blunt trauma or penetrating trauma. Someone either gets hit with a baseball bat in the head, someone gets stabbed with a knife. You have your etiologic or biological, so those are things like bacteria, viruses, fungal infections. Chemicals are ingesting something that shouldn't be ingested, or even someone who does ingest something that doesn't have an immediate response on the body but will over long periods of time, like alcohol or drugs. Then there's hereditary or genetics, people who are born with a certain trait, like the sickle cell trait, or with type 1 diabetes. As I said, it can be divided into two categories: present at birth or acquired later in life. The ones acquired later in life can be something like type 2 diabetes or cancer. Pathogenesis describes what sets the disease process into motion and how it evolves. So what causes a disease? There is something that sets off a reaction and then sets that process into motion. It's a sequence of events that occur from initial contact with the causative agent. An example of that could be someone who is a diabetic. They poorly manage their blood glucose levels, and then it starts to have an effect later on peripheral extremities, causing neuropathies, on vision with glaucoma, or kidney function, causing kidney shutdown. So all those there, the high blood sugar is causing initial contact in these areas here with the peripheral extremities, the capillaries, the glaucoma with the eyes, and the kidney function with renal function, and the nephrons. So those are things that the causative agent is causing the disease to worsen. How do we look at that or observe it or assess it? We have here signs which are noted by the observer. So me as a nurse, I walk into the room, I look at my patient, and I notice swelling to an extremity or swelling to an area. I witness my patient vomit. I look at drainage for a wound. They come in and say that they've got this wound, and I look at it and I see drainage that's purulent and smells and has an odor that it shouldn't have. And then I take a temperature, and I notice that the patient has a fever. Those are signs. Then there's symptoms. What brought the patient in? And they come in and they tell me, I've had this pain that I haven't experienced before. I've had a cough for 2 weeks. I've got shortness of breath. I've never been short of breath. I've been feeling dizzy for so long. These are all things that are subjective and what the patient tells us. It's what they're telling us. We don't see it. It's just based off what they tell us. Syndrome is a collection of those signs and symptoms, but it doesn't have an understood cause. Examples are chronic fatigue syndrome, IBS, or polycystic ovarian syndrome. The causes aren't fully understood. They have effects on individuals, and it's just something they're going to have to do throughout their life to be cognizant of and make sure that they maintain those lifestyle modifications to prevent any exacerbations from those syndromes that they have. We have diagnosis. That's how we diagnose individuals with these diseases. How to determine is physical exam, most importantly. Do your assessment. Take a history. You ask the patient questions. And then diagnostic tests. So you do your physical exam. You have a history. You suspect what it might be. But you do diagnostic tests like labs or imaging like MRIs, CAT scans, X-rays. Example will be diabetics. Someone comes in, they tell you that they've been urinating more frequently, they're constantly thirsty. You go ahead and do a physical exam and see that maybe they're obese, their diet's poor, they're not exercising, and then you take diagnostic tests and do the test to do it, like a fasting blood glucose and look at hemoglobin A1C, and you're able to finally probably reach the diagnosis of diabetes. Complications or adverse extensions of a disease, or they can also be from treatment. So the complications, as we already discussed in our earlier slides, poor blood glucose, poor management, poor lifestyle changes, modifications, not adhering to what's being instructed for them to do, will have as extensions later on in life. Or it can be from treatment. So you have a patient who's receiving chemotherapy for that cancer, and we're putting that medication into their body that causes nausea, vomiting, anorexia, and that all further leads to cachexia, which affects the way that the individual responds to treatment because they are malnourished. The prognosis is a probable outcome, the likelihood of recovery from the disease, and is often presented with the treatment options and the chances of survival. So you have someone who can, maybe reach full recovery. You have the possibility of the complications that they will encounter while they're in their treatment process, and then their anticipated survival time. So if someone is presenting with an illness and the physician says, this is a plan of care, this is a treatment we're going to give you, and this is how long I think it will take care of it. Or you may have an individual who has no more options, and the sad part of the medical field is that the physician may have to say, this is how much longer I think you have to live. All this added together leads to the diagnostic media, which is a compilation of etiology, pathogenesis, your signs and symptoms, diagnosis, the complications, the prognosis. Professional has to review all this, look at things like labs, history, physical assessments, what the patient is presenting, or the individual, and determine each step in the sequence of events to properly identify the disease, how to treat it, and then how to respond to it. This is a reference that we use. It's our assigned text for class, which is Pathophysiology, Concepts of Altered Health States. And this is my discussion for week 2. Thank you.